Okay, so I believe that we are now recording. So good morning, everyone. I'm Kirsten Peachy, and I'm with Advocate Healthcare in our Midwest region, which covers Illinois and Wisconsin. I work with our faith and health partnership programs, and also work with the Chicagoland Trauma-Informed Congregations Network, which is a kind of a movement of people that are interested in the connection between trauma and the way in which faith can be a resource for adversity and suffering and struggle, the way it can create hope and healing and protection for people in our communities. So inviting you as well to be part of that movement. And I'll include a link to our sign up page where if you would like more information, you can do that. Really excited today to welcome two people who have done an incredible work in healing activities from a Jewish perspective, particularly around addiction. And so hang on just a second. I had all this set up and now I got to find it again. So really delighted to have with us Beth Fishman, Dr. Beth Fishman. Beth has worked with individuals and families on a wide range of substance use disorders and other addictive behaviors for over 30 years. So she really knows what she's doing and has really immersed herself in this work. Currently, she's a program manager of addiction services at JCFS Chicago. And in that capacity, she trains Jewish communal professionals about addiction and how to create safe and welcoming organizations for those at risk and in recovery. She teaches mental health professionals about the cultural and spiritual needs of Jews in recovery and supports Jews and their loved ones before, during, and after treatment. She runs groups. She assists Jewish communities around the country in developing programs. So she really is known as a national leader in this space. So welcome, Beth. Really glad to have you here with us today. And then we are also have Rabbi Rob Jury, and I'm not even gonna, he's got one of those kind of signatures where the list of all of the initials goes on and on and on. He is extremely well-trained and well immersed in addiction, counseling, chaplaincy, all kinds of different therapies, as well as being a rabbi and serving a congregation. So his interests in particular relate to spiritual assessment and treatment of substance use disorders, Kabbalistic healing prayer, Jewish ways of knowing in therapy, and postmodern, post-structural Jewish attuned therapy. And he's also leading, along with his congregation, the opening of a Jewish recovery home and Jewish treatment services out of a congregational setting. So really has some interesting perspectives on how to integrate this kind of work into the congregational setting. So what we're going to do today, this is a community of practice meeting, which means that we are a community in practice together. So we'll hear from Rob and from Beth, but really this is about sharing our wisdom with each other. And so we really invite you, if you're able, when we're in discussion, to come off, I'd like to show up on your screen so that we can see each other. This is a chance for us to really talk, to hear from Beth and Rob, and also to bring our own wisdom and our own experience into the space as well, our questions and so forth. So we'll hear from Rob and Beth, and then we'll have some opportunity for discussion together. So I will turn it over. Beth, I think you're starting us off.
Actually, I'm going to let Rob give something of an intro for us, and then I will step in.
Okay, great. Thank you.
Great, thanks. It's great to see everyone this morning. If it'd be possible to screen share, I'll put up a couple of visuals as we do our quick introduction, but if not, we'll do it without them. Let's give it one more moment on Zoom. Great to see you all, and I'm excited to talk a bit about what addiction looks like in the Jewish community, what it can addiction supports in congregational settings can look like, and to share with you the Tikvah Center for Jewish Recovery and Healing, which just became licensed to offer IOP and PHP using Jewish attuned therapy. We'll be starting our IOP and PHP May 15th with Jaco coming for their site visit at the beginning of June. Super, super exciting to be with you all this morning. I just wanted to start with a brief land acknowledgement and acknowledge that I'm joining you today on the traditional land of the Council of the Three Fires, the Ojibwe, Potawatomi, and Odawa, and give honor to their traditions, as well as to honor the ancestors whose stories I continue today. Avotenu v'imotenu, Avraham Avinu, Yitzchak Avinu, Yaakov Avinu, Rachel Imanu, Sarah Imanu, Rivka Imanu, Leah Imanu, and to give gratitude to Makor Chayim, how we say source in the language of my people. So alcohol and substances in Jewish spaces occur whether addiction is present or not. There's wine used in Jewish rituals that can be used to make kiddush, the sanctification blessings over wine on Friday night, on for the beginning of Shabbat, on Shabbat day, on various Jewish holidays. It is always permissible to use grape juice instead of wine. So whenever you're encountering Jewish people and they say, oh, but I need this drink for, no, you can use grape juice. That is okay, 100% of the time. We have a holiday we just had called Purim, where there's even a rabbinic tradition to drink ad lo yodea, until you don't know either that you've had enough or the difference between good and evil. And so there's a long history of intoxication on that holiday. It is possible to observe that holiday without drinking also. And we have Passover coming up in fewer than 4 short weeks, where central to the Seder meal is drinking 4 cups of wine. You can do that with grape juice too, though we have wine in Jewish ritual fairly predominantly. And so this is one of the things we'll hear when Beth is talking with us about what do we do when wine is everywhere. There are other times drinking is common in Jewish traditions as well. We have certain holidays outside, like the Feast of Booths, Sukkot, where it's fairly common for people when dwelling in the booth to have alcohol out. And it's a common complaint among people is I can't go anywhere where it's sober. You'll even find that there's kosher certification of alcohol and cannabis edibles. And one of the big conversations is, well, I want to have my edible, but I also need to keep kosher. And so you'll find some edibles are even certified kosher. Whether that's a great idea or not, we'll leave for discussion for later. And in addition to that, there's non-substance related addiction disorders in Jewish spaces. This is where things about food and electronics and sex come up as well. And so all of these might be manifesting from use to addiction in Jewish spaces. What we know right now about Jewish people and addiction recovery, we think we know that Jewish people in the United States have same rates of addiction as other ethnic religious groups in the country. There's a little asterisk there we'll come back to in a minute. At the turn of the 20th century, though it was still pretty common not that long ago to say there's no addiction in the Jewish community. Thanks to the work that Beth has done and others in our field, we've been working to change that misknowing so that we understand addiction is very present in the Jewish community. Stigma of the Jewish community is still a barrier to seeking help. And we know that the more people who know that there are Jewish resources to combat addiction, the more people go and get services. And so by just showing up today and helping to raise that awareness, we know that you will be helping already just by doing that, people get into recovery. So some stigma. I'll give you a quick example from Jewish culture of a Yiddish folk song that translates to the Jewish person is sober. They go and they pray and they learn because they're a Jew. What does that mean then if I have an addiction? Does that mean I'm not Jewish anymore? How does that work? So there's real stigma still that we're working with in the community. Okay, that asterisk there before reminds us there is no current study on how many Jewish people in the United States are impacted by addiction. Most places that are coming out saying we know it's equal to everything else cite the same study from the 90s, which has some methodological challenges to it. The Tikvah Center is in the process now of gearing up to conduct a national study to try and address that gap in the research, but we should know we don't have a current study that accurately reflects this. It's from the 90s and has some challenges. There are studies, though, that talk about stigma and denial of addiction among the Jewish people. We know it's there, and we know that it is common to deny its presence. There are studies that are also telling us that as long as you know there's help, more people will get help, and that when there are Jewish communal interventions, Jewish people get Jewish culturally competent counseling. And receiving Jewish culturally competent counseling means they'll stay in treatment and in therapy longer. So a couple of things to know about that as we prepare to hear from Beth, that Jewish people have religious, spiritual, and ethnic needs that are unique to Jews and are important and crucial to Jewish identity. Judaism is an ethno-religious identity. So some of those understandings look a lot like religious identity, and some of them look a lot like ethnic characteristics. If you look at the most recent Pew study and look at Jewish practice compared to Christian practice, they are wildly divergent in how Jewish people identify, how they conceptualize religion, whether they like the word religion or not, how they talk and think about God. So using a religious-only framework will often miss the language that Jewish people are using to talk about their needs. We know that we have special multicultural competency needs. We know that there is a lack of Jewish multicultural competencies for Jewish people generally, and for the Orthodox Jewish community specifically, and that Jewish religion and spiritual practices are both protective factors and, unfortunately, contributing factors for addiction among Jewish people. The use of Jewish meditation and texts in therapy can be very helpful to Jewish people. It is much more common to see Jewish people use meditation and text than it is to see prayer, though prayer is also potentially helpful. And Jewish integrated therapy has a lot of benefits for people resisting addiction. So when you look at Jewish people receiving Jewish integrated therapy, the outcomes currently show better outcomes than non-Jewish attuned therapy. There's more need for further follow-up studies to that. Okay, a couple more things, and then let's hear from Beth. Places we can focus as a community of practice will include integrating sacred writings into therapy, using Jewish therapeutic documents, being able to tell stories as Jewish people love storytelling, being able to have a sense of community, of connection, and being able to use Jewish metaphors and practices, what we would call Jewish ways of knowing, in our therapy. I'm going to stop there as our mad dash introduction to get to the really great stuff that Beth has for us, and then to get to our community of practice conversation.
Wonderful. Thank you, Rob. I'm going to share my screen now. Okay, I don't think that's what I wanted. Hang on a second. Worked before. I think you're seeing my entire screen, not just the slides. Is that right?
No, we're just seeing the slide.
Oh, you are? Okay, super. Great. Thank you. All right. So I'm going to be talking about addiction programming from the Jewish social services perspective. And our agenda is going to look something like this for my time with you. I'm going to give you just a little snapshot about how we got to where we are at JCFS Chicago. You may know us as Jewish Child and Family Services of Chicago. We rebranded a couple of years ago, now JCFS Chicago, and how the addiction services came to be. We're going to spend most of our time talking about what it means to create a safe, welcoming, sacred space with regard to alcohol, because as Rob mentioned, Ritual alcohol use is pretty prevalent in Jewish practice. Not only that, though, recreational alcohol is fairly common in Jewish spaces as well. And if we have time, which I rather doubt, but if we do, I will do a kind of a quick dash through the community education and recovery support that we offer through JCFS Chicago Addiction Services. So in a nutshell, how did Addiction Services get started? At basically a social service agency that has about 400 to 500 employees that primarily serves the entire community, not just the Jewish community, in lots and lots of different ways, because JCFS Chicago is kind of enormous. So in about the year 2000, the Jewish Healing Network was founded inside JCFS Chicago. And as healing networks typically do, the focus was on bereavement and chronic illness. And I was hired in 2012, so this is history for me as well. But what I'm told by my colleagues who started the Healing Network is that they would go out and give presentations and offer support around bereavement and chronic illness to the Jewish community. And after their presentations, participants were coming up to them and saying, "But what are you going to do about addiction?" And my colleagues would look at each other and say, "Well, nothing." Like, this wasn't what their planning was about. And so they would continue on with the bereavement and chronic illness services, and participants would come up after and they would say, "But what are you going to do about addiction?" And they'd say, "I think we better do something about addiction." And so a grant was obtained and an addiction specialist position was founded inside the Healing Network at JCFS. And ultimately, a few years later, I was hired into that position. But more planning was done, more data was collected, more focus groups were had, and ultimately it was decided that there was enough issue around addiction in the Jewish community, as Rob has outlined, that we needed a separate program in JCFS just to address addiction in the Jewish community in Chicago. And I was then made the manager of that new addiction program. So we do serve the entire Chicagoland Jewish community. And by that, I don't mean just geographically, but also no matter where one sits on the Jewish spectrum, because that's a pretty wide spectrum, all the way from Jews who are completely secular or who may identify Jewishly through cultural means only, all the way to the folks who are the most observant and the most orthodox. Our mission is to serve Chicagoland specifically, but since COVID, when all of us, right, had to go into lockdown initially, and had to go remote, we have been able to put our programming on, well, we had to put our programming online, and therefore have been still serving a national audience, which has been really terrific because the Jewish community is not large. It's a small part of our American population. And then if you drill down further to the Jews who are touched by addiction, it's a smaller population even yet. And then if you drill down even further into which specific addiction one is talking about, we've been able to help local Jews make wonderful connections to Jews in recovery or still struggling with their addiction around the country and also around the world, because folks from Israel and Canada and sometimes from South and Central America do participate online in our programs. And we have 3 areas of focus: community education, largely for prevention, but also to combat that shame and stigma, which is very much a part of the landscape in the Jewish community around addiction. We offer a lot of different kinds of support for Jews who are in recovery, for those who are still struggling with their addiction, and for their loved ones. And then we also offer a lot of professional training, and that tends to come in 2 parts. One is for the Jewish community. So professionals that work within the Jewish community, that could be clergy, mental health professionals, or others, to talk about addiction with Jewish communal professionals. But then we also work with the secular or non-Jewish community, like treatment providers, about the needs of Jews in recovery. It's that first part of the professional training, working within the Jewish community, that I am going to focus on with you now. And I'm hoping that we can have a discussion, because what I'm going to bring to you and the questions that I'll ask, I think are relevant not only to synagogues and the other groups that I work with, but also to your organizations. So I think I'd like to start with an easy question. And since I can't see most of you, I hope that you'll just kind of give a shout out or maybe put in the chat or raise your hands Why would an adult choose not to drink alcohol? And this, I'm hoping, is I'm lobbing you a softball here. Why would an adult choose not to drink if alcohol is present, but there's also, let's say, grape juice? Anyone want to jump in with that? Okay, so we're going to be.
I think some people feel better with the buzz.
Some people do, but why would they choose not to? If they have the choice, if they have the choice between alcohol or not, providing an example for children, yep, that's a good one. How about if they're pregnant? Let's hope. Some folks feel worse afterwards. Thank you, Bob. Nice to see you. Rob says if they're taking a medication, that's right, for health reasons. Thank you, Crystal. Yep, so lots of reasons why adults would choose not to drink wine if it's available. And this is one of the basic places in spiritual practice, right? One of the basic places that we start with our education. And it's really important for those of you, and actually I'd like to invite all of you as I'm going through this material to think about your organizations. If you are clergy, to think about your churches or other faith-based organizations. If you aren't the leader of a faith-based organization, but you're a member of a church or other faith-based organization, think about the group that you belong to. Or if you work at an organization where there are members and you have social events, which most organizations do have, or some sorts of gatherings where alcohol is present, think about those spaces as we're talking about this. So it's important for everyone to have a basic understanding of why an adult would choose not to drink. And it isn't just because somebody's pregnant, and it isn't just because maybe somebody's in recovery. We need to understand all the reasons why an adult may choose not to drink in order to help destigmatize that choice. So when I go into a synagogue, and I've worked with almost 30 synagogues in the Chicago area by now, my objectives in helping them think about creating a safe and welcoming sacred space. Well, first, I think I'd like to say that most of us in most of our organizations, when we talk about alcohol, we are, I would say, on autopilot. We have usually inherited our policies and our procedures and our traditions and our actions around alcohol just from whatever was done in our organization in the past. We are all so busy and our organizations are so complicated and there's so much to do that it's pretty rare for us to take the opportunity to step out of autopilot on almost anything and say, okay, is this what we still want to be doing? How can we reassess whatever the issue is at hand? Oftentimes, if we do take that opportunity, it's because a crisis has happened. And that's important, but it would be great if we could be preventative and think about things like the way that we use alcohol in our organizations. So when I come into a synagogue or other Jewish organizational space, and we talk about policies and procedures and activities around alcohol, my invitation to that organization is to say, can we step off of your autopilot, whatever that is, and take these 2 hours to think about what you're doing with alcohol. My goal is not to help the synagogue to be sober, because most synagogues don't want to be, and they don't have to be. That's not my goal. If it's their goal for themselves, I'll help them. But most synagogues are not sober. They do have alcohol and they do use ritual wine. The goal, though, is to be thoughtful and to be mindful whenever alcohol is present. So my objectives are to help everyone understand the signs and symptoms of substance and non-substance related addiction, and also to understand something about recovery, to understand who's at risk for addiction, because I think we have a fairly narrow understanding of who's at risk. And in fact, there's quite a wide range of individuals who are at risk, and we want to help everybody understand what that means. Identifying best practices for alcohol use, and we'll talk a lot about that today, the majority of our time. How to have caring conversations, and this is when you have somebody in your membership, in your organization, a client or patient that you work with who's exhibiting problematic behaviors around alcohol. How do you talk to that person about it? Oftentimes those conversations are not welcomed oftentimes we, as the professionals, are anxious about those conversations. We may not have ever been trained on that. We don't know what to say. We don't know how to have it go as well as it can go. So we try to give a roadmap for what that conversation might look like, how to have it. Here's some language to use to hope for the best possible outcome. And then we try to assist the congregation in creating new policies and protocols related to alcohol that make sense, because now we know so much more about addiction than we did when their policies and protocols were likely put into place maybe 10, 20, 30, 50 years ago even, and specifically also with regard to ritual use when their traditions may be thousands and thousands of years old. I'd like to tell you a story about one of the situations that helped really bring all of this together for me, really crystallize the importance of doing this work in all of our organizations, not just in synagogues, but it obviously is a synagogue story. So I was doing this session with, it's usually the clergy and the professional leadership of the synagogue. Sometimes the synagogue will invite some lay leaders into these sessions as well. And we were talking about all of these objectives that I've just laid out before you. And things were going really well. It was a really wonderful discussion, some really good deep thought about the organization. And we got to one place where the rabbi just sort of stopped and really started to push back. We were talking about the bar and bat mitzvah situation. So that's when traditionally a Jewish young person becomes an adult, and that happens Jewishly at the age of 12 or 13. So certainly not at the American age of becoming an adult, but Jewishly, traditionally, that's the time when a young Jewish person becomes an adult. And there's the ceremony, the bar mitzvah for boys and the bat mitzvah for girls. So we're talking about this situation because alcohol is typically used as for a blessing after the bar or bat mitzvah ceremony. And we were talking about all the ways in which it's important to always have a non-alcoholic alternative whenever wine is present. And the rabbi was really, really struggling with this concept, specifically for immediately after the bar or bat mitzvah ceremony, when the kiddush, the blessing over the wine, is said. So I asked him, because he wasn't having any issues around having non-alcoholic beverages available any other time that alcohol was present in his synagogue. And he said, but this is a holy moment for him, for something, I don't know why, but this one specifically, more so than a baby naming, more so than the wedding, this moment when the young Jewish person becomes a Jewish adult felt to him especially sacred. And the wine was consecrated. And so this blessing needed to be over wine, and the young person and their family needed to be presented with wine for this blessing. And he just kept saying, but it's consecrated, it's consecrated. And I certainly can't argue with the holiness of that moment, and nor would I. So we had a discussion about the family. And I said to him, let's throw out some scenarios. Let's say that the mother and the wife in this family is active in her addiction. Let's say she has alcohol use disorder and she's active in that addiction. And the child knows it, the one who's becoming a bar mitzvah. Because children always know, right? They pretty much always know if their parent is addicted to something. And the spouse, of course, knows. So at this holy moment, you are presenting the family with the drug of choice. And the child who just became a Jewish adult at age 12 or 13 sees you handing the drug of choice to his or her mother. What do you think that's like for that child in that moment? Or let's say it's the opposite, and the mother, the wife, is actually in early recovery and still a little wobbly in that recovery, and the child knows it. And you're handing the drug of choice to this woman in early recovery. What do you think that's like for that family? And we could go on and on with other examples. I suggested to the rabbi that he was creating an impediment for this family that the other families that aren't vulnerable around addiction don't have to deal with. That he should not put a higher bar on this family who's already vulnerable and who's already struggling than the other families. You shouldn't create a situation in which this young person, a 12-year-old or a 13-year-old, has to go to the rabbi and say, you know, my mom is active in her alcohol addiction, so please don't bring wine to us. That would be very hard for that young person to say. So as I'm explaining all of these situations, the rabbi's face is changing, and he's going from kind of, feeling pretty strong in his boots about his position about consecrated wine to getting a little pale and realizing that there's a chance that he has, in fact, put his congregants into a situation like that completely unintentionally. And in pretty short order, he was talking about the best way to bring grape juice into that situation for the sake of the well-being of his congregation. So that's one type of story that comes up in these settings and in these conversations. Any questions before I continue on? I would like to ask you, is there any time in your organization, if you're a leader or a member or a staff person, where alcohol is present and that you don't have a non-alcoholic alternative? Or does everybody in your organizations always have a non-alcoholic alternative? And you can throw that in the chat or just call on out. So Crystal says Catholic faith uses wine, and I've never seen an alternative. So Crystal, can you think of a reason why an alternative would be problematic? Cindy says our congregation offers grape juice for communion. So Cindy, are they side by side, the wine and the grape juice, or do you have to ask for the grape juice?
Yes, so before we begin the Eucharist ceremony, the pastor explains we have grape juice for those who need it, as well as the wine. And then he tells congregants where to go for the grape juice, the center of the congregation, like in the middle of, near the altar. So they know where to go as well.
Great. Good to hear. And Bob says there are always non-alcoholic alternatives at the UU Church. Super. And Crystal says she thinks that there'd be pushback from the faith leaders or from the congregants. Absolutely. It's a really big kind of a sea change if an organization, if a church or a synagogue has never had a non-alcoholic alternative during ritual alcohol use. It's a big change in thought process and attitude. And that's why we do go in and offer specific training on this topic and try to educate around all the needs for having non-alcoholic beverages, but also to help understand that there are so many synagogues that it's really become the norm to have non-alcoholic alternatives. So folks don't feel like they're on the vanguard or doing something wrong or different, but they're actually joining the majority of the organizations at this point. Thank you, everyone. Okay, so we've spoken about that already. So after we give some basic education, we talk about steps to take, like, well, the first one, they're always having grape juice whenever wine is present. And of course, monitoring wine and all other alcoholic beverages. I don't know about you, but if I'm in let's say a dinner party and there's open bottles of wine on the table and there's adults and young people, every so often there's a young person who's that sort of risk-taking type and wants to grab the bottle of wine off of the table and go drink it behind the building. So always monitoring the wine. And we do things, as was just suggested in the chat, to make it easy for everyone to choose the right beverage. So if an adult does not want to drink and has an important reason to not drink, designated driver, taking a medication that interacts poorly with alcohol, etc., all the reasons we mentioned, then here's some easy things to do. Choose different color grapes for the wine and the juice. In synagogues who choose this, they will usually choose red grapes for wine, so it's red wine, and white grapes for juice, so it's white grape juice. And that makes it easier for folks to make the choice that they want to. Or they may have different types of cups, or place them on separate tables. That's very common. Different locations with good, clear signage on each. And some congregations now, and I'm pretty sure the Robs is one of them, serving grape juice only. That kind of takes all the concern out of it. Fran says we make this part of our accessibility goals. Wonderful. This is great. Fran, I love hearing that, because yes, absolutely, addiction is a DEI concern. This is a type of diversity, and if we're looking for equity and if we're looking for inclusion, then absolutely we should think about addiction in that way. Rob says our congregation is located on a sober campus. Well, there you go. We don't allow alcohol on the campus for any occasion. Always use grape juice. That's what I thought. Thank you, Rob. So as we move on in these sessions with the synagogues, we start to talk about not the ritual use, but programming. So most churches, synagogues, other faith organizations, and non-faith-based organizations. I know some folks here work at hospitals where you have patients and clients. We work with some Jewish settings that are residences for older Jewish adults. There's JCCs, Jewish Community Centers, so lots of places where there's lots of programming, lots of social programming. And my question to these organizations is always this: when you are planning a program, so those of you who are program planners, think about this, or those of you who are program participants, think about it. Who would not feel safe or welcomed at this program that we are planning or that we're standing in right now? Who would not feel safe or welcomed here? That's the basic question. So folks who are in early recovery may not feel safe in a program that is alcohol-centric. Folks who are in recovery and spend most of their time in recovery networks, in recovery spaces, or with other individuals who are either sober themselves or who are savvy about supporting recovery may not feel welcomed in spaces where recovery consciousness is not a thing. For example, programs that take place in bars. So let's go to the next step, de-emphasizing alcohol by theme and location. So if your program, let's say a fundraiser, not uncommon in the Jewish space to have a fundraiser in a bar, because alcohol can loosen people's wallets if fundraising is an important concern. Unfortunately, young adult groups oftentimes may have some sort of social gathering at a bar. That's not what we would encourage. But lots of issues there for individuals who are choosing not to drink. How to de-emphasize by theme and location. So here's a story. My department chair, her son had his bar mitzvah. He's probably 20 now, so 7 years ago. And many bar bat mitzvah services, it's either in the morning, so that's the ritual, and then there's a party at night for the adults and the young people, the friends of the newly minted Jewish adult. And those dinners tend to be, they can be large and in sort of semi-dark spaces, and there's alcohol being served to the adults. And there's usually a DJ and there's dancing, and these kinds of settings just beg for trouble with young people and alcohol. And so you have to do a lot of planning around how to keep the young people away from the alcohol and other problematic behaviors. So my department chair decided she just didn't want any of that. And after her son's bar mitzvah ceremony, they partnered with the church to create a beautiful interfaith community, and they built a playground at the church. And that was the party for her son's bar mitzvah. It was a way of being of service. So it was a Sunday afternoon, and it was fortunately beautiful out, which you can't always count on here. And they ended up with something wonderful, beautiful relationship with the congregation at the church and a playground. Now, where would alcohol even fit into that scenario? It doesn't even make sense. It's not even a thing. They had a picnic, soft drinks, water, food. So that is, to me, an amazing example of de-emphasizing alcohol by theme and by location, focusing on the activity, not the alcohol. Okay, so these are the issues we talk about in terms of safe and smart programming. And since time is flying, I'm just going to move on to the next part. But I do hope that you're thinking about your own fundraising and your own social gatherings and will be considering who would not feel safe and welcomed here. So again, thinking about your church or your synagogue, about your other sacred spaces, because in Judaism, there can be Sabbath services, Shabbat services at a Jewish community center or at an older adult living space where folks have mobility issues, and a rabbi will come in and have the services there. So we encourage everyone to think about pastoral, prayer, and program parity. Okay, so here we're talking about parity with other medical issues, because now we know that addiction is it's a disease process. It's a medical concern. So I'm assuming that your spaces have healing prayers and healing services. I believe that some chaplains had registered for this. I'm not sure if they're here. Other folks who work in hospital settings. So when you have healing prayers and healing services, or if your church has the caring activities like home visits or meals or transportation or phone calls for folks who are going through some kind of other medical treatment. So do you go to the home of the family where somebody is in treatment? Do you provide meals for them? Transportation to doctor's appointments? Do you call the family to see how folks are doing? I would assume so. And if that's the case, are you doing the same for an individual who's in addiction treatment and for their loved ones? Are you including these folks explicitly in your healing prayers and services? So I'd like to put that question out to you and see if you can toss something in the chat about what sort of pastoral or program parity you have in your communities.
While people are putting things in the chat, I would just say, from my experience, it's been, even in congregations that have some awareness of this, my experience has been that that's fairly rare, that that praying for people with addictions is part of our prayers for healing, or the kind of support we provide through meals and calls and so forth. So that's
Agreed.
Something to think about.
Agreed. I think it is rare. And part of that can be anonymity. Folks may not even know that folks are going through addiction treatment because of shame and stigma, but also their desire to be anonymous. So one way to get around that would be for the prayer leader during a healing service to simply say, let's also keep in mind those of us and those among us who are struggling with addiction. And that way people can just bring it forward. And Bob says, I agree, it's rare, like for mental illness episodes. Exactly, yes. So we can, as leaders or as congregants, simply speak up and say, let's keep in mind those folks who are struggling with addiction, with mental health issues, or any other processes that we don't typically talk about. And that way you just bring it forward. Okay, so since I am at the end of my time, I'm just going to say that there's lots of other things to do, and I'll be sure that you all have these slides so that you can look at things like putting recovery books out in visible locations, etc. The one thing I do want to say, because I know Rob is going to talk a little bit about this, is having policies in your organizations for not only congregant conduct around alcohol and other drugs, but staff standards for conduct as well. And he'll talk about why that's so important and how that actually helps him in the clinical environment. So I will stop sharing my screen now and turn it back over to Rob. Thanks, everybody.
Thanks, Beth. Fantastic. I really, the resources that you put together and the guidance is outstanding. It's some of the way the story of the Tikvah Center for Jewish Recovery and Healing began. Is at Congregation Anshe Tikvah, we started to look at a process of healing. And I'd taken my sabbatical, worked at the hospital doing a chaplaincy residency, and ended up working in the addiction treatment program as part of my residency. When I came back to the congregation and did my "What did you do on sabbatical?" sermon, a great sermon to do after you've taken a sabbatical, I shared a 2-minute memo. Hey, and I also worked at an addiction treatment program, and it was people afterwards, literally, it was a 2-minute throwaway line in a 40-minute sermon. Yeah, I know sermons can be a little long, sorry about that. But it was a 2-minute line. People came up afterwards to tell me their recovery story in the congregation. These were people who I knew of their marital problems. I knew of the dysfunctions going on in the bedroom. I knew of the financial things. I knew of the other, but wouldn't disclose that they were in recovery, at least until we started to talk about it. And so one of the things that we can do in congregations as well is make it okay to talk about. The more people in leadership and congregations talk about recovery, the more we've signaled, oh yeah, we can talk about this here. I would agree with Robert, what you were putting in before, saying yes, and mental illness generally, we found the same thing. The more we talk about the healing of body, mind, and spirit isn't a throwaway line, but we actually mean whose kids are going after school to an intensive outpatient because they need some more support with depression and anxiety. Oh, yours are too? And finding that people are having these conversations thinking previously they were alone. The more we talk about addiction and recovery that way, the more we've made it okay for people to talk about it. I want to start though with this great idea Beth brought up about policies. So when professionals in faith-based organizations don't know what's permitted, we often then use our own feelings, either as faith leaders or as administrators or as lay leaders, to try and hold them accountable for behaviors we think on our own they should have already known. We work with clergy in recovery at the Tikvah Center as well, and frequently it will be a shock to the clergy saying, I didn't know this part wasn't okay. People act like that in their house. Why can't I act like that in the parsonage? People are doing this over on the weekend and then coming and telling me that's not okay here. I don't understand. And so we have a lot of conversations about having clarity around what's permitted and what's not. So you may have right now statements for the people in your organizations that say you can't come to work drunk. You may not have statements on whether or not I can take my THC gummies before I come in the morning, and whether before I lead the worship service I can, go take my cannabis edible or take something else. We probably don't have those. And then we're shocked when people are using in particular ways that seem to violate what we thought were our unstated policies. So part of accountability is transparency. And part of that means having these policies so that we can hold one another accountable for them. One of the things that we've seen in the congregation is the more we are transparent, both with you're not the only person facing an addiction in the congregation, and with our behavioral expectations, the more the community can norm around them. Kind of hoping things will change otherwise hasn't really been so successful. We have also taken an approach in the congregation that our own individual thinking on religious matters may or may not hold up to scrutiny, interrogation, and further thinking. And so we will often say things when we have or a congregation that has some other rabbis in the community who will come up and say, I don't think it says that. Great. Show me what you're looking at. Let's talk it out. What are you looking and seeing frequently? And I'm really curious from the group, have any of you had this experience where what we thought it said either biblical based in the Talmud or Jewish law, if you're doing that in the canons, in the whatever guidance of your faith, sometimes what we thought it said isn't actually what it says. Yeah, I've seen some people go, oh yeah, that happens a lot with substances, right? Where what we thought it said about addiction, what we thought it said about wine, what we thought it isn't actually what it says. And our pre-assumptions keep us from making the changes we need for healing in our communities. So that's often a place to start, is to know, what does it actually say in our faith tradition about addiction and recovery? And are our immediate reasons why we can't take these pro-recovery actions actually our own assumptions and not at all based in what's possible? So I always encourage folks with that. I know we're running on time. I want to talk a little bit from the clinical direction. So the Tikvah Center now offers both outpatient, intensive outpatient, and partial hospitalization treatment using Jewish attuned approaches to therapy. So we went from the congregation saying, oh, there's a lot of people in recovery here who weren't able to talk about it because of the stigma, to how can we intervene and help further. One of the places we looked at is opening a kosher recovery home. Turns out it was even easier to open a treatment program in this state than a recovery home. We are still working on our recovery home, which we are looking forward to getting open, hopefully now within the next 24 months. We've made through the next 3 hurdles. In the meantime, it turned out there was not a Jewish treatment option for addiction in the state of Illinois or in the Midwest. We are now the only addiction treatment program using Jewish attuned therapy licensed to offer IOP and PHP outside of Los Angeles. It was really exciting here. So Beit Teshuvah in Los Angeles does amazing work. They're a long-term residential treatment program and longtime leaders in this field. They're the only other people licensed to offer this level of care. The other places in New York and Miami that you can find some Jewish attuned therapy can only offer outpatient therapy, which is needed. And sometimes we need IOP and PHP too. So in the congregation, we were tired of sending our kids away saying, oh, you have a substance use disorder? Let's send you off to Los Angeles. I mean, it's a nice place to be, but what are we communicating to our community members when we say, oh, you have this thing, go away, and let's send you out of state? So now we can offer treatment here in town. Our treatment, and let's just take a quick look perhaps at that. That could be useful for us. So I'm going to share a couple more slides just so we can see, and I really want to be in dialogue together. So our full IOP and PHP is opening in May, which is great. May 15th is our opening day of IOP and PHP. We have JCO coming to do their site visit not long after that. It's a very complex piece in the state to open a treatment program, but we're there. We're opening starting with adult services, so 18 and over, and we are using Jewish attuned therapy. We're also offering Jewish community support. So something that we're hosting this year is a community recovery Seder on April 2nd. It'll be in person and online for people to see that most of our time in recovery doesn't happen in primary treatment. So the goal of primary treatment is a very short-term intervention. This is why partnerships through congregations, through larger faith-based communities are so crucial. You'll spend most of your time in recovery, not in primary treatment. So what's it look like when we're doing Jewish attuned therapy? It means we begin at intake with Jewish ways of identifying. Often the language of are you Jewish or not, the question we might ask in many settings, is wholly unhelpful. I mean, it's helpful to know you're Jewish, but Jewish people often are uncomfortable putting their names on lists of Jews. We have some historical trauma related to what happens when institutions ask us to make lists of Jews. And so we're often very uncomfortable with that. And it's widely known that in hospitals and other outpatient settings, Jewish people underreport their Jewishness because of the historical trauma of making lists of Jews and what happened when we participated in that. We also know there's a lot of ways to identify as a Jewish person. And for people outside of the Jewish community, the question, are you Jewish or not, is probably significant. The question among Jewish people isn't so much, are you Jewish or not, or are you Orthodox or not, is a much more complicated ethno-religious, cultural, intersectional conversation. You can be Jewish and be a Jewish person in an observance that does not have female rabbis and does not recognize certain components that are commonplace in LGBTQ plus communities. And in those communities, they might be in direct conflict. You can be Jewish and be an openly queer rabbi who went to a queer seminary and has a congregation that identifies as LGBTQIA plus friendly and centered, and everything in between. So simply knowing is someone Jewish or not really doesn't tell you anything. So right away at intake, we want to know a lot about what's Jewish look like for you? What's that mean for you? Is that a religious claim, a spiritual claim, ethnic claim, cultural claim? We use Jewish ethnic identifiers. There are different kinds of Jewish ethnicities we ask about that are really salient for people, including to be able to say, I actually don't know. And it's one of the things that's been a challenge for me. My conflict is I don't know who I am and how to identify. And we work with that. It goes into an assessment. Our spiritual assessments, which is one of the requirements in addiction treatment, is a spiritual assessment. One of our components there is to really get a sense of what your history is. Maybe that looks religious and maybe it doesn't. Maybe it looks spiritual and maybe it doesn't there either. It might look cultural, it might look ethnic. We really want you to just give us your story. And we're able to have that conversation both in the ways of identifying and the spiritual assessment that uses Jewish cultural, religious, spiritual language. So recently, we had another addiction treatment provider say, we tried to do an assessment for this person, and we just can't tell, is there a disorder or not? Great, send them over. And they said, we're calling you because we think the reason we can't tell is their Jewish stuff is making it really hard for us to know, is this just the way they talk? Are there really spiritual practices they can't do anything about? Is this really, and they talk a lot and fast. And yeah, so it was great. I see you've called the right place, send them over. They came over and we did our own intake and assessment. And one of the things that's common in many Jewish practices is what's called cultural overlap. So you may have seen this on television where they portray Jews talking over one another a lot. It looks like they're interrupting and not stopping while they're interrupting. The linguistic term for that is cultural overlapping. We're actually not interrupting. We are adding and changing to the conversation in real time. And that's what was required to do this person's assessment. He didn't stop talking for 60 minutes, and I had all of the questions answered because you culturally overlap and change what's being said in the conversation to the place you're interested in talking about. It was a really important place for that. We also use Jewish religious, cultural, and spiritual practices in primary group. So we'll allow that kind of crosstalk in our groups where other places will shut down crosstalk. We will spend not so much time talking about potential relapse at Christmas, because that's not a primary time Jewish people relapse, but we're going to talk a lot about potential relapse at Passover and at Purim and at the Jewish high holidays. I need full treatment plans that say what your non-relapse plan is during that time. We spend a lot of time using Jewish metaphors also, even non-religious Jews. So Jewish people who say religion isn't my thing, use religious terms in their cultural Jewish expression because it's an ethno-religious piece. So we'll use a lot of these same terms that sound like suddenly we're making a theological statement, though they're not. So we're able to sit with the terms and find out, oh, what do you mean here? And to challenge back. Last thing we'll leave on there is it is a common practice in Jewish culture to disagree with one another and to push back. So sometimes in primary treatment, when your therapist is telling you what they think ought to happen, and you're going, I don't know about that. You might be labeled as resistant. You might be labeled as difficult for treatment. You might see that resistance and difficulty for treatment as a need for a higher level of care. We often read that as you're just acting like a Jewish person in a Jewish culturally known way, and we'll argue along with you. Not in a malicious and punitive way. We understand that's how we're making meaning. Like, it's this and not that. Okay, great. That's not a sign of resistance. It's a sign of meaning making, which is a Jewish spiritual practice. We use our treatment program at the center. So everyone has an individual treatment plan, and our program overall is focused on Torah, recovery, and you. And it integrates Jewish sacred text, which is one of the ways Jewish people make meaning, with questions about addiction and recovery that help us work with our primary treatment assignments. And then we see, though it began at that intake, it continues through continuing care, congregational partnerships, and Jewish life in recovery. Most of your time in recovery isn't spent in primary treatment. Most of your time is spent outside of that, where this is where congregations come in, where Jewish faith partnerships come in, where communal partnerships come in. And we may need continuing care from a clinical perspective. So we will offer that at the center. We also work now with several local congregations who have staff members in recovery who the congregation wanted to be able to have ongoing testing, drug testing, or what if we're concerned, are you really intoxicated here after lunch or not? And they struggled. They didn't have a policy saying, what are we going to do if the front office is worried that when the rabbi or the cantor, the educator comes in, that maybe they had a beer or 5 at lunch. So now, instead of trying to figure that out, we help them with a testing policy that they can either call us to come on site and to test on site, or they can have the person brought over to us. We will either transport them or they can bring them over to us and we will test them on site. But it's a way to help congregations move out of the business of, should we be the ones testing? We tell this to families too, who suddenly say, we better go buy a whole bunch of quick cups to be able to test our kids at home. Mom and dad, why are you trying to be the treatment provider? You be the mom and dad. Let us be the treatment provider. We don't need to confuse our roles. You're not in this alone anymore. And that's been really empowering for people. So just as a quick recap, and then I want to get into our discussions. Jewish multicultural competencies that explore the intersections of Jewish and other identities are the essential beginning points of Jewish multicultural competencies. If we only know to ask, are you Jewish or not, or are you Orthodox or not, we have not reached the minimum level of a multicultural competency. We've simply recognized that Jewish people exist in the world. Understanding what it means to be Jewish and the next part of what comes after that is a crucial component of understanding Jewish identity. Jewish people tend to identify as Jewish across all their identities. So seeing the way it's intersecting is crucial to understanding what Jewish means for them. Using Jewish metaphors, languages, and practices, really important to us. Our holidays are different. When we might relapse are different. Even the way we speak is sometimes different than other folks. We're not resisting, we're just acting Jewish cultural ways. At our center, we use Jewish models of supervision. So our models of supervising our clinical staff are also informed by Jewish ways of knowing, so that we are taking our own ethno-religious understandings and meaning makings in the world and helping even the people through the process of supervision access those Jewish ways of knowing. If we want people to act authentically as themselves, then when you are implementing a Jewish form of treatment, you need to also have a Jewish method of supervision. So we do that. And we also are proponents then of continued evidence-based practices, which require Jewish mixed methods, research methods, which take into account varying identities of Jewish in terms of demographic identities on your quantitative side, and understanding what it's like to actually interview Jewish people and get answers that are useful, as opposed to get answers designed to make sure you don't put us on a list and do more intergenerational trauma. So we have a paper under review right now in a mixed methods journal on how one ought to do this, and we continue to collect data to be able to use those evidence-based practices. I want to stop screen sharing and just jump into some more questions of what are some thoughts, feelings, reactions, or questions you're having. You've heard Beth and I share a bit of our experiences. What's resonant with you? What sounded like, hey, I want to know more about that, or what sounded completely different? And we just want to have space to acknowledge, yeah, we can be different together too, and that's okay.
I think one of the dilemmas in some of the work I've done is that we restrict services when we know somebody is in addiction. So funding, for example, if someone needs to, is in need of rent money, food money, that sort of thing. Well, if we know that you're in addiction, we don't support you as well. And that's been, I think, a real problem in terms of the stigma.
Can I ask, as we enter into the discussion time, if you're speaking or if you put something in the chat, if you could just say, just introduce yourself as you speak. Again, we're creating a community of practice just so that we learn to know each other. So Fran, thank you. And want to just say,
Sorry, yeah. So I've worked in a number of Jewish agencies. I'm working right now as a social worker with both a number of certifications, but I'm working at Cathedral Counseling where the clients are diverse.
great, thank you.
And as we're getting ready to mute with that too, I'm going to also share at the Tikvah Center, and then Robert, I see you jumping in. I want to share too, not all of our clients at the Tikvah Center are Jewish. Our non-Jewish clients predominantly are people who have religious trauma from other faith traditions, who are looking to explore religion and spirituality in their treatment in a way that seems safe enough and familiar, though not the tradition they're coming from. So it makes this space between, I want to see what it's like if I don't carry all of my trauma with me, with something that's familiar enough. So it's been a really interesting component for us. We had not predicted that before we had opened. So it's really interesting. Robert, you're jumping in. I didn't mean to cut you off.
I feel my imagination being broadened tremendously by your presentations. I appreciate that. And if you know anything about Unitarian Universalism, which is my home faith tradition, there's a tremendous diversity in terms of what a Unitarian Universalist means too. Does it mean you're a strict secular humanist? Does it mean you believe in a faith of a God and everything in between? And so, some of it is cultural for lifelong UUs. Some of it is anti other religions. So I join UUs to get away from them. So the whole framework of thinking about where a person's coming from in terms of their language, their metaphors, their practices, just really resonates with me tremendously. I was thinking of a situation in my local congregation where a mom would talk about how their young adult who had tremendous addictions problems and went in and out of rehab and recovery and hospitals dozens of times over the years. And she kept saying, what do you have in the way of young people prevention activities, like For example, within the UU tradition, we have what's known as the Our Whole Lives program, the OWL program, which focuses a lot on sexuality and sexual identity and gender identity. But we don't have a good, powerful program when it comes to substance use and addictions and how to navigate the cultural dangers in our society when it comes to addiction. And so this whole thing about what do we have for prevention activities for young people who are just getting ready to be adults is an interesting question.
I can speak to that a little bit because we have offered prevention programming for young Jews for many years now. We typically provide that training in the Jewish day schools because those are private schools and they won't receive any of the typical, government funded or school mandated programming around drug prevention. So they don't get the don't say no message in Jewish day schools. But also to youth in synagogue Sunday schools and in synagogue youth groups. And we inherited that program, or we actually bought it from the Jewish treatment program that Rob mentioned that's out in California, Beit Tshuva, because they have a whole prevention wing, but they encouraged us to make it our own because LA and Chicago are really different in all kinds of ways. But the message, the foundation of that program is, I believe it started as 6 sessions, and the first 5 had nothing to do with drugs. It was only in the 6th session that drug issues came up, and it was partly just basic drug education, but it was building on the other 5 sessions, which were all about what are your values and how do your values. So first, really exploring what matters to you as a young person, you yourself, and you then your cohort, what matters to you, and then how do you apply that to your family relationships and to your peer relationships? How do you apply those values across the board in picking your extracurricular activities and then introducing other risky behaviors? How do you apply your values to what you do choose to do and not to do in other risky ways? And lastly, here's what drugs are, and how do you apply your values, now that you've thought about your values in a variety of other ways, to whether you do and don't use drugs in general, or any specific drugs, if you want to drill it down further, because some young people will choose to use some things and not others. How do your values, now that you've had an opportunity to really explore those, impact your decision making around drug use? So that was the approach. And of course, all of that is through a Jewish lens for us. So we talk about Jewish values and yourself as a Jew, and how do those general, whatever Jewish values means, because of course it means something different to every single Jew, because that's kind of how we are as a community. How do those intersect with your own values, your family's values, and ultimately to your values in choosing to use or not use, and how?
Thank you. And what did you say the curriculum was that you used? Was there a name or a website that?
They called it the Partners in Prevention program, but it's no longer available in that way. So, Bob, you know what I will do is a little bit of research for you on if the Partners in Prevention program is available or an outline of it. If not, I will show you what we have. I'd be happy to share that with you.
Thank you.
Sure.
And Robert, do you want to just say just a word about who you are?
Yeah, thank you. Yeah, I'm Robert Scrocky. I'm a retired clinical social worker, and I do a lot of work with the Interfaith Mental Health Coalition and the Chicagoland Trauma Informed Congregations Network. Pathways to Promise too, which does companionship trainings for our area here. It's great to have this presentation. It was very informative. Thank you.
I
was
found
also
myself.
thinking-
Oh, I'm sorry.
sorry.
Go ahead, Beth.
Thanks. I was thinking about another area. Rob mentioned where Jews can be labeled as resistant. in some treatment settings. And one of the things that we offer to the Jewish community is what we call INR, which is basically community members. We don't always know how they find us. Maybe they Google Jewish addiction and we pop up. Of course, now Rob is going to pop up with the Tikvah Healing Center. We're so thrilled, truly, that Rob is building such an important program for the Midwest and nationally. So they may find us on Google or through word of mouth, who knows, and they just call us cold community members and they say, you know, we're in trouble. I have a loved one that's in trouble with addiction, or I myself am struggling. I don't know where to go. If you know anything about the addiction treatment world, especially the for-profit world, it's mostly for profit. It's very confusing. It's very expensive. It's sort of, it's kind of a malicious environment. And for people who are vulnerable, they don't know where to go. They often call us because we're part of the Jewish community. We don't do treatment, and we're a nonprofit. So I think there's some inherent trust built in there. And so they'll ask us, you know, where should we go? So we do a brief screening and give them the best resources we can think of for them for treatment or support or whatever, which is also partly why we're so thrilled that Rob is now available as a resource. But oftentimes we'll get calls from folks who have been in a treatment setting, especially if that treatment setting is 12-step based, or these days, if not fully 12-step based, at least has a 12-step component. And folks are introduced to the first 3 steps of 12-step in their first month of treatment, which is very typical. And that whole concept of turning my will and my life over to the care of God as I understand God, which is in those first 3 steps, is really, really, really problematic for, I would say, the majority of Jews that we've worked with. Just sort of the concept, the basic concept of turning my will and my life over to the care of God, what does that even mean as a Jew? Like, first of all, maybe means nothing to a lot of Jews, not even really a Jewish kind of thing. But also for those Jews who can wrap their head around that concept of turning my will and my life over to the care of God as I understand God, has some really scary recent historic trauma to it, because not all Jews have fully engaged with what it means to be a post-Holocaust Jew yet. I think as a community, we are still in the very earliest stages of grappling with that spiritual trauma. But there is sort of an undercurrent understanding in the Jewish community that if God, whatever that even means to a Jew, if God wasn't there for us as a community and did not save us, when most of us in Europe, you know, if 2/3 of the Jewish community was murdered and God wasn't there, then how can it be safe for me to turn my will and my life over to the care of this God who didn't save most of the rest of us in living history? So that is a truly deep spiritual question. And these, folks in early recovery and early treatment are very vulnerable. And most staff in these settings don't understand that the first 3 steps of a 12-step program are inherently problematic, troublesome, and confusing to a Jewish client. And Jewish clients can easily be labeled as resistant, just flat out resistant to recovery in those settings if there isn't a basic understanding of the difference between a Jewish client with Jewish spiritual needs fundamentally and other clients. Judeo-Christian isn't a thing in early recovery. And we hear that so often with the folks who call us and say, treatment was problematic, or my loved one is being accused of not wanting to engage in treatment. And if staff have some basic training in Jewish spiritual needs, let alone in early recovery, they'll understand that they're asking too much.
I want to build on the beautiful statement that they made, Beth, because I think yes. And by knowing to not label Jewish people as resistant because Jewish spiritual needs are so different than Christian needs, Jewish people may be able to be just fine in other treatment programs. And I think you perfectly named for us sometimes that work requires a different skill set, right? We only learn what we learn in the places we've gone to learn it. So if you didn't learn about complex Jewish trauma, intergenerational Jewish trauma, and how to treat it, how do we expect treatment programs to do that? That was a large way that the Tikvah Center needed to come to being. And I want to talk for just a second about that, and also to say something I don't know that we've named yet, that Beth and her organization and I and my organization aren't in competition. We are wonderful collaborative partners. The Tikvah Center really came into being to fill a gap that JCFS Chicago Addiction Services was not going to fill, right? So we didn't just say, oh, and here we go. And we had many collaborative conversations about what is JCFS Chicago Addiction Services designed to be able to do. They do that magnificently. We are always thrilled to receive referrals from them, and they weren't designed to be a primary treatment program. Having now opened a primary treatment program, I completely understand why you were not designed to do that. That was a special version of bureaucratic excitement, and it was why we came onto the scene to fill a gap in the community that needed filling, and that we couldn't just expect existing organizations to take on that burden to fill the gap. So instead of doing that, we created a second component. With that third step, one of the ways we work with the third step in treatment is by reorienting Jewish people that struggle of, wait, is God going to actually do this for me or not? That is quintessentially Jewish. We read it all the way back in the Bible with Jacob. We take them through in part of our treatment to our medieval rabbi commentators who are writing at length about, wait, free will or your will, God? I don't know. I can't have both of these. Hold on. They're wrestling with that in sacred Jewish text. That's not a secret. That's what they're talking about. Many Jewish people don't know that. They know from the lived cultural experiences, but they haven't had access to that text, and haven't had that text presented to them at the right point in treatment. So we normalize that as a Jewish spiritual practice, and then start to take some trauma-informed approaches to it. What does it mean to do this post-Holocaust? What does this mean to do this post all these recent historical traumas? What does it mean? So we had someone come to us from another treatment program. I was really grateful, Beth, that you named this, where they tried to advocate for themselves and say, but the Holocaust. And people said, why are the Jews always bringing up the Holocaust? And when we did the transfer, we tried to explain, oh, well, this person's family were from most recently Europe. Jewish people's origin stories aren't in Europe, they're in another part of the world. And most recently, they came from Europe. And during the Holocaust, 2/3 of all the Jewish people in the continent of Europe were murdered. That wasn't just displacement camps, that wasn't just lost. 2/3 of the entire Jewish population on the continent of Europe were murdered. That's recent memory for many Jewish people in the United States. And so having that knowledge and helping to reorient with the trauma is really crucial in addressing Jewish stories. I'm so grateful, Beth, that you named that for us. I think that's really important for us to know.
Wow, that was like a little graduate class right there in pastoral care considerations for Jewish people. Thank you. That was terrific. We have just a couple of minutes left. I know you won't be able to answer this in the time we have, but one of the questions that I've had, we're a congregation. This is the Trauma Informed Congregations Network. So, people that have an interest in congregational life. I'm really curious about a congregation, the process of decision making that a congregation would go through to say, we are going to invest ourselves in creating this kind of a center for treatment and for recovery. Could you just say a couple of words about how you led that process, or kind of what that process was like within your congregation?
Sure. One of the first places we start with congregations is, do you have a parsonage you're not using? Because if you do, you can use that to support addiction services. Having housing available for people is crucial. What to do with these parsonages, what to do with these properties that we used to need and we don't need, those can all become healing spaces. You don't have to open a licensed recovery home, though I'm all for opening licensed recovery homes. It is incredibly complex to do that. We haven't gotten our home yet open, soon, but not quite yet. Opening what's called an Oxford style home, which is a 12-step recovery oriented home. Doing a faith-based Oxford style home does not require special licenses and certifications. You can do it with a house plan and an amendment in your lease. And a house plan and amendment with your lease says that everyone agrees as part of the people renting here to not use drugs and alcohol. And that if whoever is kind of the house manager, the person overseeing the multiple people who are renting together, suspects someone, that we can have you drug tested and have a meeting about it. We can have house meeting protocols. It doesn't require extra licensing. So it's a great way for congregations to start. I think using the resources that Beth was mentioning was crucial in our community. It was how we introduced the topic in the conversation. I think talking about it is essential. We learned that by surprise. Had we not started to talk about it, we wouldn't have been able to do it. Hosting 12-step meetings is really useful and important. Being able to host non-12-step recovery meetings too, whether that's Celebrate Recovery or another faith-based program, or whether it's Smart Recovery, which isn't a religious program at all, and is a way to say, all right, maybe you're not yet ready to disclose to your religious leaders what's going on. Come on and check out the CBT. Making it okay to come and disclose you're in recovery, absolutely crucial. It's the thing that we have as part of our intake conversations with all of our clients. Are you a member of a faith community? Oh, sure, yes. Do they know you're here? Oh, no. Okay, let's talk about how we're going to tell them. We can't tell them. Well, how are they going to be able to support you and your family if you won't tell them? Right. And so making it okay for people to come up and disclose that information is really important. Those are just a few of the processes there.
Well, we are at our time, and I just am so grateful to both of you for all that you have invested in this work, the way in which you've led so thoughtfully in your own community, within the Jewish community, and there's so much that the wider religious community can learn about the integration of spiritual practice and the integration of our sort of our religious and cultural lives and values in this work, as well as the way in which a faith-based entity, whether it's Jewish Child and Family Services of Chicago, JCFS Chicago, or whether it's the Tikvah Healing Center or a congregation, can really be a resource and an anchor for the wider community on this really critical issue. So I thank you, and I think really appreciate everyone's participation. I'm going to put in the chat, if you're interested in joining the Trauma-Informed Congregations Network, there's a link there where you can sign up to, I just put it in the chat, to join the mailing list for that. So with that, we wish you a lovely day and hope that the day forward will really be wonderful for you. So Rob and Beth, do you want to just hang on for a second at the end? But everyone else, thank you so much. And we'll see you again soon, we hope.
Thank you, Rob and Beth.
Thanks, it was great to see you.
All right. Well, thank you both so
You're
much.
still recording, just in case.
Oh, thank you.
It's fine
Yeah.
to know.
How do I? Oh, there we go.